New figures from the Canadian Cancer Society are showing a concerning trend. Cervical cancer rates have plateaued after years on the decline. More than 1,600 cases are projected for 2025. That's compared to just 1,300 2 decades ago. So a lot of doctors are worried that the goal of eliminating the disease by 2040 may now be out of reach. Dr. Shannon Salvador is a gynecologic oncologist at Jewish General Hospital. She's also president of the Society of Gynaecological Oncology of Canada. She joins us now from Montreal. So, Dr. Salvador, Canada, as I understand it, was on track to eliminate cervical cancer. Why aren't we on track to do that anymore?
Yeah, thanks so much for having me here tonight to discuss this. I find this is an incredibly important issue. If you had asked me 10 years ago, I would have said that Canada was definitely on track and we weren't going to have a problem. But over the last probably 5 to 6 years, we've really seen that the cancers actually increased for a while, the rate of the cancer, of cervix cancer, and now it's reached a plateau. I think my biggest concern around this is the lack of access to screening in Canada. Patients don't have access to primary care physicians and to nurses the way that we used to enjoy, and we used to be able to have these conversations with our primary care physicians about generalized screening. What should we be doing? And so because of that, I think that people are no longer having the conversations about what they should be doing for screening and when they should be doing it.
Yeah, so that must be frustrating for you that isn't happening to the extent it should be happening. Beyond that, I mean, there is, I believe, a vaccine, right? What's happening with vaccine uptake?
Exactly. So there is an HPV vaccine which works incredibly well. Almost all cervix cancers are caused by the HPV virus. And in Canada, we've had access to the HPV vaccine for a number of years now. It's given usually in grade school for best effect. Unfortunately, we now see that there is a decline in vaccination rate in Canada for HPV vaccine. It's actually only around 62% for the entire of Canada. That's not good news. To hit this goal for the elimination of cervix cancer, we actually need that rate to be up around 85 to 90%, and we're not on track to be meeting that. I find this is most likely also, again, due to vaccine hesitancy, but also just lack of education around why do we do this vaccine? What is it that we're trying to prevent with it? Going along with screening, why are we screening for HPV virus and how can you get that done?
So if these things were to change, and it seems like it's achievable that they would change, so if people did have conversations with primary care physicians or nurse practitioners or someone else about screening, and if people did get access to this vaccine or take the vaccine, which in fact they do have access to, how would that change outcomes?
I think we'd be back on that track that we were enjoying about 10 years ago. We were declining at almost 2% per year, which was fantastic. It was definitely getting us in line for that 2040 goal. Especially with screening now, because almost all provinces have a plan or have already implemented a plan to change from what used to be the old form of screening, which is Pap testing, to the new form, which is an HPV swab. This is a wonderful way to do screening because it's being done in a physician's office or in some provinces, people even have access to self-collection. They can actually request a swab to be mailed to their home and do the swab at home and send it back. This is a wonderful way to get access to people who either don't have primary physicians or who are in marginalized populations in rural communities, area where it might be very difficult to get screening access.
So in our final 30 seconds, why don't you just make a direct appeal to women who are watching or people who have women in their lives? What's your message to them?
I would really strongly encourage anyone who is over the age of 30 to find out what is the screening method in your province and what is the best way to access it. If it's not through your primary care provider, almost every province has clinics where they're able to do HPV Pap test screening. And like I said, some provinces do have access to HPV self-collection that you can request one to be mailed to your house.
And it matters? I mean, if they don't do it and they, I assume the alternative, I assume that this is one of those cancers that you know, you want to do everything, well, not everything, but you want to avoid.
Exactly. The nice thing about the screening is that if we detect that you have this virus early, or if you have the changes of the virus, this is an easy treatment that we can do in a clinic with a pre-cancer phase. You never end up having to go through cancer treatment. Unfortunately, once someone has an advanced cervical cancer, especially anything that is outside of the cervix, it becomes very difficult to treat. The 5-year survival rate of an advanced cervix cancer is only about 20 to 30%.
Dr. Shannon Salvador, the president of the Society of Gynaecologic Oncology of Canada. Thanks for speaking with us.
Thanks so much for having me.